definitely what comes to mind is seeing them in the toenails.
In the toenails.
Fingernails.
Or at the base of the nail.
A lot of people think that skin cancers only occur in sun-exposed areas. But the truth is there's an amazing number of areas you can get skin cancers. So for example, I have 2 patients who've had melanoma at the back of their eyes. I've seen melanoma in the genital area.
But also seen a couple in the genital area, which comes as a bit of a shock to everybody. Yeah, look, it's usually not related to sun exposure, which is the interesting part of it. So yeah, unless they do a bit of nude tanning that they didn't tell me about.
In about 90% of the time in sun-exposed areas. So common places are going to be on the scalp, shoulders, arms and the back of the hands, but obviously there are exceptions. And melanomas and non-melanoma skin cancers can turn up just about anywhere on the body. Some of the more unusual places that I think quite a few of us here have seen have been on the hands and feet, particularly on the fingernails, and that's what I may call lentiginous melanoma. I have seen them in eyes as well. And so I think the key point to remember is although sun exposure is a risk factor for all types of skin cancer, it doesn't necessarily mean that they turn up in sun-exposed areas. They can turn up absolutely anywhere on the body, and that's why a full skin check is so important.
Yeah, so people who have skin types like me, the good old Celtic or Anglo-Saxon, fair skin, people who have freckles, those who were born in Australia are at more risk than someone like myself who's come into the country as an adult.
If you have a primary relative, so mother, father, daughter, brother, sister, who has melanoma, you're at increased risk. Someone who has spent their first 12 years of their life in Australia is at increased risk of melanoma.
We profile people at higher risk as being those with very fair skin, those who tend to burn more than they would tan if they were exposed to sunlight. People with a family history of skin cancer, particularly melanoma, are at increased risk of melanomas themselves.
The paler you are, the higher the risk. So if you've ever gone by the name of moon tan or pasty, definitely you're at a higher risk. Or if you got red hair, definitely.
So the most important one is change. In fact, 50% of the melanomas I've seen have been because people have said, hey, this black spot is changing. So change is a huge indicator. Natural moles and freckles tend to remain very stable over time. So change is very important.
So the main thing that I would check for is it a new mole that has been present for 2 or 3 months? Or is it one that you've had for a long time but it's started to change? So we look for what's called asymmetry, and that's basically where you see an irregular edge to the mole. It may be growing. We also look for color mix, so if it looks different to what it has previously, so it may have been a dark mole which now has some light bits into it.
Definitely very interested in anything that's changed. So change in any skin lesion needs to get looked at. The combination of pink and brown together is also a worrying sign. So pink and brown makes you frown. That's a useful thing to remember. Or if it's got a lot of scale on it, that's something to have a closer look at. Yeah.
So I tend to direct patients towards the Melanoma Diagnostic Guide, which is available online. And if you were to type in ABCDE skin cancer into the search engine, you'll find a diagram showing you this. So if looking at a spot, if it's new or if it's changed, that's definitely something to pay attention to. But following the ABCDE pathway, we want to know if the lesion is asymmetrical, if it's got a raggedy or irregular border, if the colour is variegated, meaning if there's more than one colour in the lesion, if it's a big lesion, if that diameter is greater than 6 millimetres, or if it's changing or evolving, then we definitely want to know about it.
So there's multiple modalities that we can use. If it's a BCC or an SCC or a melanoma, the most common treatment is surgical excision, but that's not always possible, and so a person can have radiation treatment. So they have a large lesion on the centre of their nose that would be destroyed by surgical treatment. External beam radiation is very good for that.
It would very much depend on the type of lesion that we're seeing, the size of the lesion, where it is on the patient, and also to a large degree patient preference as to what type of treatment we pursue. Options would include topical therapies, that is things like creams and ointments that can be put straight on the skin. In some instances we could use cryotherapy, which is use of liquid nitrogen to burn a lesion. But often definitive therapy for a lot of skin cancers will involve an excision where we surgically remove that skin lesion, and that gives us the best chance of clearing it.
Always the definitive management for any skin cancer is to try and remove it surgically, so to excise it. There are other options including creams. There's a couple of chemotherapy creams, Aldara and Etudex, which are generally able to treat them, but not all cases. Just depends on the severity of the skin cancer. And then in some cases we can also freeze them with liquid nitrogen, but we can't do that with all of them. It's not intense enough for all of them. Yeah.
So, look, the jury's sort of out at the minute, I think, on how much is too much. It used to be you were told 10 minutes in the morning and 10 minutes in the evening was okay of exposure of your arms and face.
The big thing to look out for and to check is the UV level for a day. So UV levels of 3 or below are considered safe, but in Australia, frequently in summertime, in the middle of the day, we get levels of 15. So we get 5 times the radiation dose in the middle of the day that we get at the start of the day or the end of the day. So avoiding direct sun exposure during that time is really important.
Really the key is in early life, and often this is something hard to change. So if somebody's had a lot of burns, in the first 10 years of their lives, so greater than 5 blistering sunburns, that's a big risk factor for melanoma. So trying to protect your kids from sunburn is really key. Other than that, trying to be sensible, avoiding the 10 a.m. to 3 p.m. window of the most intense sun exposure. That's very useful. But really the problem sun exposure is those people that spend most of their time in the office like me and then get intermittent burning. That's actually the highest risk for melanoma.
The slip-slop slap has been the mantra for many years. It's been slightly extended to include seek and slide. So seek shade is a new recommendation, as well as slide on sunglasses. And I think that they're both very valid points to add to slip, slop and slap. How much sun exposure is too much? A controversial question, especially with conflicting evidence suggesting that we should encourage some degree of sun exposure in order to increase vitamin D levels. The current recommendation is that if the UV index is over 3, then you should be getting enough sunlight just with day-to-day activities without seeking any further sun exposure deliberately. But that if the UV index is less than 3, so that would be in the middle of winter or early spring or late autumn, then certainly a little bit of sun exposure with exposed arms, for example, during the middle of the day is not too harmful. Very difficult to put an exact amount of time on that though, so common sense should prevail.